Hi and welcome to Moto. I'm Moshe K. Levy, and today we're going to be talking about riding your motorcycle during the COVID-19 coronavirus pandemic. First, a little housekeeping. The magazine I've been writing for since 2003, Motorcycle Consumer News, folded this past February. It's a sad day for the industry. It was the only magazine with no advertising, which allowed reviewers like me to be completely honest about what we were reviewing without worrying about offending some advertiser or another. I'll be sending my articles to other magazines for now, and we'll see what goes on in the future. I'll keep you updated. Anyway, back to the topic. Some of you may remember my wife Terry, as shown in episode number 23, about riding motorcycles when you have young children at home. Terry's been a nurse for about 24 years and currently works at the hospital which, right now at least, has the most COVID-19 cases in New Jersey. She's on the front lines of this pandemic, and I want to pass on what she tells me so that my fellow riders can use this information in their risk calculations. I should also mention that my company serves the U.S. Department of Defense and is thus required by federal law to remain open as an essential supplier. My company is located in the COVID hotspot of Bergen County, New Jersey, which itself, just this little county, has more active positive cases than 38 entire U.S. states. And we're open every day no matter what. So I'm still going to the office every day, and she's obviously going to the hospital for a full work week. We're both about as far from quarantined as you can possibly get right now, unfortunately for us. So here's what I'm learning, and I want to put a big caveat out there first. What I'm going to say next is still very regional in nature. As I'm shooting this on April 4th, where we work, Bergen County, has more corona cases than 38 U.S. states. Just this little county alone, and it's very, very densely populated, only minutes away from New York City, which is currently the COVID epicenter of the entire planet. So what I'm saying is just my perspective here. It may not apply to where you are for now, if you're in a more rural or less affected area. So here's my take. A well-informed motorcyclist understands risk and calculates it on every second of every ride. He doesn't put his head in the sand about what's involved each time he goes out. He immerses himself in this. It's his passion. She reads about riding. She takes courses. She attempts to get better all the time. Fine. And the normal routine thoughts on the road, at least in my head, are that if the unexpected happens, I'll wind up in the hospital, and somehow, hopefully, they'll piece me back together again. Of course, it's naive, but I take that risk happily because of the spiritual and mental and physical benefits I get from riding my motorcycles. But that's not where we are today. Where we are today, at least around here, is total pandemonium inside the hospital. It's mayhem in there, like a MASH episode. You've got exhausted, really exhausted staff, frustrated by a lack of basic supplies. And they're doing the best they can, and undoubtedly they're the unsung heroes of this whole crisis. This isn't to insult them at all, but it's to tell my fellow riders to carefully consider what's going on. Stop. Think. Is now the right time to wind up in the hospital after a crash, when every gurney is taken, when you're completely surrounded by the infected, when every nurse and every doctor is on a solid 3 or 4 week or more of consecutive 12-hour shifts, maybe a shift and a half, 12 to 16 hours a day, day in and day out, for weeks on end. Don't kid yourself. This isn't a joke. The care that you're used to, the medical response, the resources you're used to, they just aren't there right now. And by every reliable measure, we're nowhere near the worst of it. The worst is yet to come. This changes the risk calculation dramatically. Is it still worth it to ride? For me, the answer is a resounding no, not around here. I see what my wife is going through on the front lines of this pandemic. I see how she's coming home drained. I'm not willing to add to it. And anyone who knows me knows I've never said no to riding. In over 22 years on two wheels, I think I've done it all and taken every stupid risk you can imagine. Rain, snow, hail, all kinds of weather, all sorts of terrain. Rush hour commuting for 2 decades on the most dangerous highway in the most densely populated state in the country. 3 kids, still riding, all sorts of crazy circumstances. I go anyway. 15 to 20,000 miles a year most years. Fine, but not this. Not now. We've got to play it smart. Here's what you can do though. Most of you are stuck at home, right? Support your local dealer. He needs it right now. He'll ship to you. He's your neighbor, not Amazon. Call him up, buy some spare parts, give your bike an early tune-up or add some accessories, or buy a gift certificate if you don't need anything right now. Plan some events for when this too passes. It'll help steer your mind towards better days ahead. We look where we want to go, right? Have some video conferences with your riding buddies. Lament the plans you had to cancel this year, but start thinking about how you'll execute an even bigger and better trip when things clear up. Watch some motorcycle-themed movies or read some books to whet your appetite for adventure. There's 1,000 things you can do from inside your house that won't add to the chaos going on outside your front door right now. I'm telling you what I think based on first-hand reports from the front lines of the COVID hotspot. And much like the virus itself, I don't give a good goddamn what your ideology is or what your politics are. It's just irrelevant bullshit right now. And you'll find out soon enough whether this is a real crisis or made up. Give me a break. We all ride, so we're all in this together. This pandemic hits all of us, all of our families, everyone around us, especially those healthcare workers dealing with the worst of it, nurses like my wife and others. We have to think and we have to act accordingly. When things get back to normal, I'll see you back here on the Motomouth channel for more of your favorite gear reviews. Until then, keep the shiny side up and seriously think about keeping your kickstand down.